The participant number climbing. We appreciate your patience as we allow just a few more people to join, and we will begin very shortly here. So thank you for your time today so far. So it looks like we're holding steady with our participants. People will, of course, join and drop off as it's lunch hour, and we're very understanding. But I can't tell you how pleased I am that you've chosen to share some time with us today. And on the presentation, Beyond the Fixed Cost, Rethinking Health Plan Finance and Fiduciary Duty for CFO and HR managers, and really whomever you are based on your job title. I'm Ann Lewandowski. I'm the host and founder of Patient Value Insights and Equitable Evidence. I have worked in healthcare for over 30 years. I've seen all sorts of healthcare finance and plan participation, and I've also worked for a major pharmaceutical manufacturer. I am so pleased to be here, joined by Chelsea Ryckis and Brenda Kruse. Chelsea, do you mind introducing yourself?
Yes. Hi, everybody. Thanks again for taking some time with us today. I'm the co-founder and president of Ethos Benefits, and we are a fiduciary-based advising firm working with mid and large market employers nationwide on their healthcare strategy. And something that's a little bit unique about Ethos Benefits is our founding story with my husband, Donovan. He was actually a Series 65 fee-based 401k advisor who had the legal term as a fiduciary under the 401k space. He saw his first health plan, witnessed all the fraud, waste, and abuse, and 10 years ago said to me, that's where we need to be. That's the problem we need to fix. It impacts way more lives. And, just the fraud, waste, and abuse was so much more. And he said, these healthcare lawsuits are coming. So we, 10 years ago, designed a practice around fiduciary-based advising, took those 401k principles and put it into action. And then we waited and we're like, why does nobody care? We're telling people about ERISA fiduciary duty and prudence, and we're talking through these things, these concepts that everyone's talking about now, but nobody cared for so long. Now people care, and I'm so glad that you're here and that you care, and hopefully you'll take a lot from today's session. Brenda.
Hello, I'm Brenda Kruse. I'm Chief Financial Officer at Axiom Healthcare Services. We are based in Kansas, and we are an administrative services company that serves senior living facilities, specifically skilled nursing and assisted living facilities. And we have around 1,000 employees in our portfolio.
Thanks for joining us here. So today's outcomes for the webinar that we're really hoping that you are going to walk away with are defining some key metrics for your plan, for your health plan, selecting and really identifying a team to monitor and control health plan vendors, because any good compliance program, the hallmark is monitoring and control. And then we're really going to dive into this concept of differentiating between health insurance and health finance. Health insurance, I'm going to tee it up for Chelsea and she's going to take it away, are really these unexpected things, right? They're your auto accident that is truly an accident. Whereas health finance is basically you have a predictable plan spend because you know the number of people on your plan and you can anticipate what that looks like throughout the year. Chelsea, why don't you dive into that just a little bit more?
Yeah, that was a really good way to set the stage. So think about insurance, right? The unlikely, untimely event of flood, auto accident, like Ann said, or a death, right? Why we have life insurance. That when you think about health insurance, unlikely, untimely, unpredictable, those words don't really land, right? It doesn't make sense because it's actually very predictable. In fact, it's so predictable that I can tell you, you can expect 18 claims per employee on your plan annually. Now, obviously, that's not going to be 18 per person, right? You're going to have people who use the plan a lot. You're going to have people who don't use the plan at all. And obviously, you have dependents taken into that number as well. But how about instead of focusing on that annual premium, right, that fixed cost at the bottom of the spreadsheet with the same three options you see every year, how about instead of focusing on that one fixed cost, we focused on the cost of these 18 claims per employee per year? Because that's actually the secret. If you take anything away from today about being a fiduciary, managing the frequency and severity of claims. So what is a claim, right? A claim is simply a request for dollars. And as those of you on the call that are familiar with healthcare financing, you will know the dollar amount requested for a service varies greatly. There is not one fee in our country per service. It's a fee per payer, right? So here's an example to really get into this concept of controlling claims. We had somebody recently, this is a client, a gentleman was bit by a spider on his pinky and he needed a skin graft. Goes to the hospital. The hospital wants to charge $81,516 initially. Whew, a pinky, that's an expensive pinky, right? Well, thankfully, they're very kind. They gave us a discount down to $57,000. Well, our team saw this and we're like, well, that's way outside of our plan limits and what's reasonable. So we talked to the physician, and he happens to work at an ambulatory surgical center a couple miles down the road from where the employee lives, even closer than the hospital. And he's willing to do it there because he makes the same amount. So as you can see, no shocker, it's been up a minute here, 97% cost difference. We had that same skin graft, same pinky, same doctor, $2,000 instead of $81,000 billed to the plan. And the employee got the procedure for free. So that's what I mean about the claims cost is so variable, right? And it's not conditions. I used to say this to CFOs and HRs, and they would say, well, we can't control if our employees get cancer, or we can't control if someone's bit by a spider. And of course you can't, and you don't want to control that. But what you can control is what you pay for the cancer, for the diabetes, for the heart attack. That's where the CFO mindset needs to shift to, from health insurance, one annual premium a year, to how much am I actually paying for these claims? How am I financing this healthcare? Brenda, would you add anything to that?
Yeah, I mean, I would just say, the typical, our typical process is we get, our renewal from our broker late, or our incumbent carrier very late. And then, it's probably an increase, and the broker may go back and negotiate a slightly smaller increase. But basically, we are presented with the same 3 to 4 options as we were presented with last year. And we basically choose the least worst option that's available. And then we say we'll do it earlier next year and be more on top of it. And next year comes in, it's the same thing. So as CFOs and benefits teams, HR people, we have to have a better process. And, so you have to partner with someone that's really willing to dig in and help us change that process and get out of that same old benefit renewal rut.
I know, Brenda, you'll be sharing your case study actually. So guys, we have 3 case studies we're going to be reviewing today. Brenda's is last, and she is an amazing example of what can happen when you shift that mindset. Ann, you were going to say something?
I was just going to say, Brenda, thank you so much for introducing this next slide, right? The health plan DNA, and walking us through sort of the typical renewal process. Do you want to jump in, Chelsea, and talk through sort of these 4 key parts that you see as a broker advisor?
Sure. So every health plan, whether you're on the call and you're fully insured and you're the person seeing those 3 or 4 options every year, or maybe you're a little bit more advanced in healthcare financing and you're starting to unbundle your health plan, no matter where you are on the spectrum, you have these same 4 components as the basis, as the root of your health plan. So you have your third-party administrator paying and processing claims. You have your network, or maybe you don't. That's interesting too. Stop loss insurance, which is the actual insurance piece of the plan, and then your pharmacy benefit manager, which Ann has some really good insights on this for us in a little bit. But nonetheless, when you are in that situation where you're kind of seeing those same options every year, what's happening is one entity, so usually a carrier, is controlling those 4 pieces. They own the TPA, they own the network, they own the stop loss, and they own the PBM. I want you to think of it like a closed box. If somebody owns everything, it's proprietary, it's confidential, your negotiating power goes way down. Closed box. But imagine if you go to market and you look at all of these options, you go from 3 or 4 to full market. I mean, you can market this 50 different ways if you wanted to, right? And not you CFOs and HRs, but the people that you hire prudently to do this for you. But the point is that that's how you create competition, and that's how you lower cost. And that's how you get insight to your data, because you open the box, because you're starting to work with aligned vendors that are willing to share with you all of that financing and accounting information.
And I can't emphasize enough how each of these has a controllable portion to what Chelsea said, right? I have seen examples where your PBM is charging $2,500 or more for a simple medication that you can get from a cost plus pharmacy for $100. Your TPA processing a claim at $99,000 when if you walked down the street into a different network, it would be $40,000 for the same infusion costly drug. Um, and then of course your stop loss steps in and starts to say, hey, we don't want that on the plan anymore, but that really starts to impact your patients and your employees. One thing about the pharmacy benefit manager that I really saw this, this is Chelsea's slide, and it says determines the formulary. I just want to talk through this for just a second because we heard last July, all three major pharmacy benefit managers who control 85% of the market were called before the House Ways and Means Committee and asked questions about the cost of prescription drugs. And they actually testified before Congress that they are not responsible for your employer plan formulary. Now, Brenda, I want to ask you, as a CFO, um, who do you rely on to create this formulary decision? I'm really curious.
Well, in the past, I've always relied on our pharmacy benefit manager. Isn't that what we pay them for? So it is, it really makes you nervous to think that you are the one responsible when that's not my area of expertise. So we need to find a better way, and find the way to have them held accountable.
Absolutely. It kind of brings into question, Anne, like, who is a fiduciary and the idea of the word fiduciary, right? So I think most people know, if you're keeping up with all the lawsuits in the news, the only true fiduciary is the plan sponsor to the beneficiaries of the health plan, right? But imagine what could happen if all four pieces of your health plan operated with the essence and the spirit of fiduciary, or if you hired an advisor or a consultant who's, founding principles, or just in general, they take on that with you, right? I want to differentiate between, there's a lot of noise in the market right now. And you and I talk about this all the time, but everybody wants to call themselves a fiduciary, or they'll be a co-fiduciary. And it's like frustrating to someone like us who, like, for 10 years was like, well, we've been talking about this and now it's a buzzword. Are you actually doing it? But really, the legal liability is only on the plan sponsor. But again, imagine the possibilities if you align with a whole host of vendors who want to operate with that same spirit. That's the point.
Yeah, I think there's a couple of really interesting legal points that we will talk about a little bit later, just to kind of dig into this concept of like, what is co-fiduciary? What is a functional fiduciary? Just to kind of sink our teeth in a little bit more, but let's jump into our case studies. Chelsea, why don't you kick us off with case study number one?
So company number one has 300 eligible employees. They've got 125 insured, and their employees are nationwide. So the challenge with this, as you'll see on the next slide, is personal relationships. So let's dive a little bit deeper. So again, this is a case study, and we're showing case studies today that kind of swing the pendulum of fiduciary responsibility. And we'll let you make your own assumptions. Anne's going to give us the compliance perspective, and then Brenda will give us the CFO perspective on each one. So to go a little bit deeper into company number one, the consultant or the broker that was hired was actually a friend of the CFO, a golfing buddy, that kind of thing. Unfortunately, there was absolutely no committee. There was only one decision maker, and there was no procurement process, meaning there was no followed framework to look out for red flags, or to like checks and balances, if you will. That's the whole point of a procurement process. So that just didn't exist. So what this resulted in ultimately was misaligned vendor selection, not just with the broker, but the whole way through the plan. Every single piece that was picked was not operating in the best interest of this employer. Unfortunately, that resulted in unfavorable contract terms, with prohibited transactions, gag clauses all through the contract. And then the compensation disclosure that was provided was very conflicting. It actually didn't tell about 50% of additional compensation that was undisclosed from a bonus. That was only brought to the attention of the employer when they asked, because we told them that, hey, that's probably something that contributed to you being recommended this option. There was no vendor oversight. So the TPA actually paid a claim when we were going through the claims related to an auto injury without pursuing subrogation. So nobody was monitoring the claims data to even look for opportunities like that. And then a misaligned PBM, and kind of spoke to the big three, right? So it was a big three, and it left a projected 104,000 in pharmacy overspend annually, and that was definitely a low estimate. But as you can see, one decision on a personal relationship, not being willing to benchmark that person, has a lot of downstream impacts, not only for the company, but for the employees as well.
Yeah, so Chelsea, two things that let's just make sure that we're very clear with our audience. Prohibited transaction and subrogation. What are those?
Well, so subrogation, I'll let you do prohibited transactions because you're like the absolute expert on that one. But subrogation is just basically where you're going to be doing an investigation on the transfer of like associated rights for a claim. So should this have gone, in this example, it was auto injury. So it should have probably gone into an investigative mode. Perhaps the auto carrier, insurance carrier should have paid for it. That's ultimately what would have been determined had somebody been looking at it.
Yeah, so we just saw a very interesting case, which is Cunningham versus Cornell in the prohibited transaction space. And really, the question before the Supreme Court a couple of months ago that they just determined last week is whether or not a plaintiff, the person bringing a lawsuit, needs to allege something more than a prohibited transaction, so unreasonableness of fees, for example. And the Supreme Court actually sided with the plaintiffs, the people bringing the appeal, so Cunningham, stating that for these prohibited transactions, which are really self-dealing essentially, so somebody is getting something from the plan where they are a person of interest within the plan. So for example, one thing that I hear very frequently is a vendor potentially doing an RFP and then requiring a $50,000 RFP buy-in fee from that particular vendor, for example. So that has the potential, we haven't seen this ruled on, to be a prohibited transaction because the person putting out the RFP, say a broker advisor, is also getting something from the people that they were supposed to be vetting, for example. So anything else that either of you want to add there?
I just want to hit on the disclosures, the compensation disclosures a little bit.
Okay.
I'm fairly new on our benefits committee. I mean, I've been kind of like filling bits and pieces of that role for a while, but we really now, thanks to our new benefits advisors who are really helping us understand our fiduciary liability, really kind of digging in and making sure that we understand all of our responsibilities. And one of those responsibilities that I want to make sure you all are aware of is your responsibility to look at the compensation disclosures. It really kind of made my mouth drop when I found out how much our brokers were getting paid, and then to find out that there were probably undisclosed bonuses as well, really hit home as to how much we're paying for our plan when a lot of that is the built-in bonuses and things like that. So the question that keeps coming to my mind is, why are we incentivizing our brokers for poor performance? If our plans are not doing well, but yet they're making more money, that's very sad. And so we really need to think of this in terms of, we wouldn't incentivize our employees for bad performance, so why are we incentivizing our brokers? So I think that that's an area that everyone just needs to be aware of and make sure that you understand that you do have some power there, because in the past I always just felt like the fees were just built in and we had to pay what we had to pay, and I'm finding that that is not the case.
I
So
really
sorry, and to Brenda's point, in the last week, I've had two different conversations. One was with an HR who said that her broker refused to give her and her HR team access to the employer portal, the carrier portal, because they didn't need it. If they needed anything, it would go through them, which is a huge, huge red flag, right? And then the second one was a CFO that had asked for a compensation disclosure, never been given it, and the person just the consultant just wouldn't do it, like refused to give it. Giant red flags. And to Brenda's point, your consultant's compensation is absolutely negotiable. I was also told this past week that the percentage of commission that a broker was asking for wasn't negotiable because the carrier mandated that it be at least 10%. That is a lie. It is not true. The best practice, and I think Ann's about to get to it, is to go fee-based, right? Or even performance-based, which is something, and if you want to dive into that, we can.
Yeah, so I think just to pick out a couple of pieces that you dropped there, Chelsea, is there is currently a lawsuit from a whistleblower to a major brokerage firm. I'm not going to drop their name, but essentially they refuse to provide disclosures on their rebates. The rebates were approximately $20 million. So
1 year.
yeah.
That was 1 year of rebates, by the way.
So, the clients started doing the right thing and doing exactly what Brenda recommended, right? Asking for the disclosures, understanding where this was flowing. And they had a chief compliance officer who was told that they could not disclose, even though that is required under the Consolidated Appropriations Act of 2021. And eventually he was fired, and he has now filed a whistleblower lawsuit against this particular firm, stating that they were non-compliant with federal laws and regulations. So, unfortunately, as a potential client, there are some protections, right? Like if they outright lied on their compensation disclosure. But if you're in this situation that I think is a little more common that Chelsea and Brenda maybe mentioned, that you're asking for a compensation disclosure and your vendors are resisting it, and there's a whole beautiful list of vendors that need to be providing this to you. That's, anybody related to implementation or plan design, people like me or compliance folks, transparency tools, your TPA, your PBM, the list goes on and on. You need to know their direct and indirect compensation. And if they're not willing to provide that, you have this very uncomfortable position of needing to follow the very good 401k guidelines, which are that you need to disclose to the Department of Labor that you are unable to receive this, that this vendor is not providing it, and that you will no longer contract with this vendor. So that's a really key point, because if you continue to contract, you're potentially moving into a more gray area of the law. And I would certainly recommend that you speak with your counsel, your lawyer, to talk through what steps you need to take in order to maintain compliance with the Consolidated Appropriations Act and other transparency requirements. Go ahead.
Just one thing you said, Anne. So when she said every service provider in the plan, it's anybody making over $1,000 of compensation needs to be disclosed. And another key point is, especially from your consultant, you want to be able to see their compensation prior to making any plan decisions. I can't tell you how many times I've had a conversation with a company that eventually comes over, right? Maybe like a mid-year change. They just renewed 5 months ago. They were shown this and this and this, but they were really persuaded on this option. Even though this one was a little bit cheaper, they went here. And then we take over the plan, we start marketing, we're going to make a change, but we start getting the compensation from the current plan. Weird stuff, per script fill fees, bonuses, all sorts of stuff that was never disclosed, but can absolutely influence the decisions that people are making and what options are putting in front of you. So make sure you're getting that prior, get it after open enrollment, because especially if it's commission, right? You have more employees enrolled, they're going to have a higher compensation. If anything changes within the year, if they do anything weird behind the scenes, they are obligated within 60 days to provide you a new compensation disclosure. So best practice, ask for it before you make a decision, ask for it after open enrollment as well.
And make the expectation clear. If you're struggling with a compensation disclosure, I'll send out an email. You have my email. I have one that is a free template that you can use. It will include this. It will also require that they sign a good faith estimate of their upcoming annual compensation and agree to provide it to you within 60 days. The evaluation that Chelsea hit on, right, is starting to become more and more important. Understanding who is participating, what their background is, and exactly where you sit in terms of compliance with some of these rules is becoming increasingly critical, which is why I've created an independent sort of heat map and fiduciary evaluation metric for your broker advisor. It will be available for your TPA and other service vendors so that you are checking and making sure you're hitting all of those boxes, right? You understand, hey, are they willing to advise me as a fiduciary? Are they bringing me functional fiduciary solutions? Yes or no? Have we done an RFP in the last 5 years? Are they bringing me solutions that are not providing that compensation? And, I talk with a lot of vendors here and there, and the key thing that they keep telling me is, Ann, any compensation we pay to a service provider, a broker, advisor, vendor, whomever, that is passed on to the plan. We do not eat that cost. So all of that money that might be being paid to your vendor, your broker, advisor, whomever, that is ultimately coming out of your pocket and the pocket of your employees. Anything else you guys want to wrap up here?
There's one thing I'll add, which is a lot of the times, depending on the size of the firm that you're working with, there's a difference between maybe the one consultant that you're working with and the strategy for the whole firm. But ultimately, what you want to look at is the business model of the firm that you're working with. Is this a firm that relies heavily on bonuses to pay salaries? They've been around for a really long time, and this is a model that's too hard for them to break to really bring that co-fiduciary status or functional fiduciary options to the table. And you're allowed to ask those questions, right? Like you can ask that. How much of your book of business is with one carrier versus another carrier? How much of that book of business is bonus related? How much are we contributing towards your bonus potential? You want to know those things. And remember that a lot of the times you may love the person that you're working with, but they might be just a salesperson. And you need to be able to see clearly and have these tools in place to be able to almost like checks and balance from yourself, right? Like I know with my own hiring process, I love everybody. I want to hire everybody. I needed to put in place like all these checks and balances. So I stopped making bad decisions 5 years ago, and it's really helped. So just something to consider.
Yeah, so let's get on. Let's go to company number 2 and talk through their challenges and opportunities. Chelsea, why
Sure.
don't you take it away?
Yeah, so 4,000 eligible employees. We had 2,500 insured. These employees were distributed pretty evenly throughout all of the Southeast, and the challenge here was no insight and no oversight.
I can't wait to hear more about this.
So same thing here, no procurement process. It was 5 years of steady double-digit increases, shown the same options year after year. 7 figures of savings was brought to the table, but the HR manager was never able to take that proposal and give it to the CEO because this was actually a childhood friend. So it literally never made it into the decision-making process. They had no access to data because of very strong gag clauses within their contracts. And the interesting thing is that when that was brought to the attention of the CFO, he assured me, no, our contracts were reviewed. They're in the best interest. There was no data analytics whatsoever. So you remember we talked about healthcare financing. A key component to that is being able to see every single penny that's being spent within your health plan. We call it to the penny accounting. There was none of that. There was one page for 4,000 employees, one financial summary page. How can you possibly be doing your due diligence or yes, Anne?
Okay, Chelsea, I have to know one page, how many thousands or millions of dollars were reflected on this page?
I honestly, I wanted, it was over 10. It was over
Okay,
10. Yeah.
that's easy.
Yeah, well over 10. And like the sad thing was they've only ever seen double digit increases, and it was a multi seven figure decrease brought to the table that was never even considered, just because of the personal relationship once again. But the interesting thing, the personal relationships, we've already touched on that. The really interesting thing here was no insight, meaning no access to data, right? And at that size, you'll hear carriers give you things, tell you things like, oh, well, you have 98 insured and we need 100 to be able to give you that report. And then guess what? When you have 110 insured, well, you need 250 for us to be able to carve out your PBM. Like it's always this moving goalpost, right? So 4,000 employees, you should have pretty much anything you want with most carriers. But nonetheless, no data, all on one page summarized. And unfortunately, the compensation was never benchmarked. So there was 25% commission on the dental. Let me give you some context on that. A dental plan, let's talk Florida, in the state of Florida can range anywhere from like $25 to $40 per month for an employee only, depending on all the plan designs, right? This dental plan, the most basic one, started at $60, and all of that was commission for 4,000 employees. It really begs the question, is bigger better, right? You think bigger company, better benefits, bigger broker, better solutions, bigger carrier, better protections. Not the case in healthcare.
Well, and it gets to my point earlier, right? That all of those commissions, all of that money that's being made on the back end is immediately translated into cost for you and your employees. One thing that we did not note is if you have questions or comments, feel free to drop them in the chat. I'm getting a couple of text messages that are saying, that's my experience. Yes. So it's sort of like our three-fingered magician AI generated guy at the top here. So one thing we really want to start walking through here is, contract clause improvements. So Chelsea's already covered that under most contracts, the name fiduciary here, and I wanted to preserve their anonymity, but is the plan sponsor. So insert your name under that black box, insert your IRS EIN, and then, understand that, UMR, depending, may or may not embrace this concept of fiduciary duty. And then, of course, for legal service, that's your address. So if somebody is upset or thinking about moving forward, and we're really focused often on these big class actions. One thing that has not caught a lot of people's attention is the claims denial, prior authorization, benefit denial. ERISA does allow individual lawsuits to be filed against the plan administrator. In this case, it would be your name, to pursue payment of those claims. So here is some really great contract language from PBMs relating to rebates. Now, I talk about rebates as post-sale concessions because when you look at some of these contract clauses, right, you see all sorts of relationships. So you see collection, educational fees, bona fide fees, all of these different things, but they're not getting passed on to you. So you may be getting 100% of what's called a rebate, but you may not be receiving 100% of that PBM's compensation for providing these drugs to your plan. So that's a really key term that I want. So this actually just popped up on my LinkedIn this morning, courtesy of Chris Deacon. And this is actually a language from a court filing stating that Cigna is actually acknowledging it is a fiduciary for the purposes of claims processing. Now, getting back to my first point and Chelsea's first point, These are massive corporations, right? So Cigna actually owns Express Scripts. Express Scripts has said it is not a fiduciary for the purpose of formulary creation and management. So just because a portion of a contract acknowledges that they have a fiduciary status, and often Cigna is incentivized to pursue claims, right? They may get to keep a portion of that claim that was overpaid or mispaid. They may not have those same incentives on other parts of their contract, so they may still be resisting in other court filings fiduciary status for other things like prior authorization, your PBM activities, and stuff like that. So, Brenda or Chelsea, anything you'd like to add there?
It's convenient that they can be a fiduciary when they want to be, but when they don't want to be, they don't have to be. That's what I always take from things like this. It's like, oh, it's convenient that you decided today was the day that you wanted to do this.
Yes. So definitely, Chris Deacon was very skeptical of their comments and said, "Good to know, but be very cautious." So, transitioning into data. So, this is actually a file that Equitable Evidence received from a broker. And Brenda, I would love to know, how are you going to take action on this one?
Yeah, that would be very hard. But I will say, we were in a fully insured plan previously, and basically this is what we got, or if we even got that much, so um it was hard to affect change when you have no data. So data is key.
And I think it's not just data, but it's how you start to analyze this data, right? Because here is a very different data visualization and analytics that Chelsea will walk us through.
Yeah, this is just an example of like a dashboard. It's not even getting into the actual procedural codes or the prescription codes. Like we get that level of data in our plans. I'm really excited to get into Brenda's case study because this is the type of stuff she's going to have access to this year.
I
But
can't wait.
I know, right? We're going to have a good time with it. But ultimately, instead of it being that one annual premium, right, that you're looking at, and then you find out, 2 months before renewal that you either had a great year or you had a bad year, but either way, you're getting an increase, and then you see that one other number. Imagine being able to see every single claim, every healthcare claim, every medical claim de-identified. You do not need to see employee names. I know that that is a big issue. But this is healthcare financing, right? Like this is what a CFO would dream to be able to see. And I mean, this is a group that just renewed 5/1 for us. They're almost $2 million under budget from what we expected. We expected their cost to be that. They're 2 million under because we have all this insight. So as expensive drugs come in, we're finding alternate pathways to get them. We're taking employees from hospitals and putting them in surgical centers with the same physician. When you have that insight, that's what actionable data is versus that sheet that Ann just showed us. It's like, cool, check a box, I have data, but do you really, and can you do something with it? That's the more important piece.
And thank you to those who commented that the chat was disabled. It should be enabled now. Here's some samples of data dashboards and comparative analytics that Equitable Evidence has put together, right? So, what Chelsea has been saying this entire time, your spend is predictable. We see 4,300 approximate claimants. We see 37 approximately thousand claims. Average paid per claim is 261. We're in excess of $9 million in gross. And then if you look at the Christmas tree, as we've come to call it, it's really a comparative analysis. And in this case, it was comparing Mark Cuban's Cost Plus to CVS. Cost Plus is in green. And so anything in green, you see the increase in savings. And of course, there are opportunities to save with CVS as well. So you see that in the red there. So once you start to look at this, right, you can start to look at who and how do we want to start to finance these types of drugs. And you can start to create a very sophisticated plan. So here's the case study that Chelsea and Brenda have been waiting for. Case study number 3. Take it away, ladies.
Brenda, this is all you.
All right. We were on a fully funded plan, a level funded plan 2 years ago. We did switch brokers, and we ended up we had a bad claims year, and so we ended up back at fully funded, which is not where we wanted to be. But at that time, it was our best worst case option, or least worst case option, I should say. And so, sorry, I'm looking at my notes a little bit. So our premiums were high, our deductibles were high, and we had little to no data from our carrier. I'm very thankful that our Chief Human Resources Officer met Chelsea at a conference, and so we connected, and they have been advising us since last fall, and we have made huge strides. We were struggling to recruit and retain staff. We are in the senior living industry, which has been hit very hard over the last several years. And so we had to find a better way to get a better health plan for our employees. And so the incumbent renewal came in at a 1.9% increase, even though he had a tremendously good year last year. And our new advisors knew that we deserved better. And so after digging in, we realized that we did as well. We have been in the constant, I don't know.
Like that cycle.
Cycle, that's what I was looking for. Constant cycle of, increase. And then, this next year, we still get an increase, but it's not as high. So, we were actually thrilled with a 1.9% increase from our fully funded plan until Chelsea and her team helped us dig in and realize that's not where we deserve to be. And so we were able to go with a level funded plan and ended up with a 12.79% decrease, which saves our company and our employees a combined $380,000 for the year. So we're very, very excited about that. We were able to save the company money, but also we were able to lower our employee deductibles, which were very high. So we brought those down, and also lower our employee premiums by anywhere from 27 to 38%. So very excited about that. Also, they were able to negotiate full access to claims data. So we will know down to the penny what is being spent on our employee health plan. And so that's very exciting. In addition, we're able to initiate a 501(r) advocacy program, which basically helps our employees know if they qualify for reduced costs through nonprofit hospitals in our area. And so we feel that that will also be a way that we can reduce our claims costs, because it will help the employees and help our plan. They also, our consultants also are providing a additional measure of clinical bill review, where if you go to the hospital, send them your bill, and they're going to look through it and make sure there are no duplicated charges, no ineligible charges, or no upcoding. So we're really excited to see where this year is going to go for our plan, and ultimately, hopefully, we can get to that self-insured level. And none of that would be possible without Ethos, and also learning about the fiduciary process. We really didn't know, the few of us that are on our benefits team, what kind of liability we had being those fiduciaries for our plan. And so we're very excited to, be good stewards for our employees.
I would add, Brenda, that you and your team, and I would say pretty much every employer that I've worked with, even if you don't have a fiduciary process in place, you have this moral, ethical guiding ethos, if you will, like a principle, right? That you've been making really great decisions off to the best of your knowledge for the past few years. Like, you guys you care so much about your people, and it's really cool to see how, like, we've just attracted those types of employers over the years through this. But so I feel like your team and you have done an amazing job, and it's just exciting to put in an official fiduciary framework. So our next step with Axiom is, well, one other thing I'll mention. You heard her mention that we had to go level funded. We couldn't go all the way this year because we lacked data. Keep in mind, CFOs, HRs on the call, you don't need to jump headfirst into the most complex cost containment solution, super fancy, complicated. You want to design, and by you, I mean, you want somebody for you to design a multi-year healthcare strategy that actually fits the needs of your employees, right? You don't necessarily always want to go with the cheapest option. That's not necessarily being a fiduciary and being prudent. What's important is documenting why you made the decisions you made and negotiating some of the things that Brenda mentioned. So we did go with a level funded carrier, but we negotiated the heck out of that contract. We removed gig clauses. We got full, like she said, access to our data, and not through their data analytics. It's feeding to our data analytics. Like, we own the data. We have to the penny accounting. We removed audit clauses in the contract that basically was like, oh, you can't have an outside party review high cost claims. We removed that. We implemented a vendor that would. So even if you feel like you're kind of stuck in that middle step where technically Axiom is, right? Like, they're on a middle step onto a pathway forward, there's still so much you can do. And I think that like goes to Brenda's point earlier is, if you have the right partners, you really have way more power than you realize, whether you're fully funded, level funded, or self-insured.
And I think that really goes to the experience and knowledge of the people advising you, right? Part of being a prudent purchaser, and I do this in my everyday life, right? Like, I used to love to DIY, full disclosure. I've gotten older and wiser. And
Yeah.
I've also like sold a house and gotten like, what the heck is this mess that you created as a DIYer, right? So, and I think that's really where you can start to differentiate, simply between people who are there to make a sale because they're on commission, right? And so maybe it's the difference between just going into a car dealership, or bringing in an expert in car mechanics and taking a car to your mechanic and having them check it over and saying, hey, this is a really good deal. These are all the things that you're looking for. This is not my area of expertise, but knowing that these people know health, know healthcare, know healthcare finance, how it's working, the perverse incentives that I often talk about, and really how to start to mitigate those, right, for your plan, for your employees. So that's really where the vetting process of your advisors and consultants becomes absolutely critical. And one thing about the 501R pathway, I'm so excited that's an opportunity in Kansas. Some states do actually bar that. New Jersey is one. I know that if you're insured, you can't actually get any assistance with financial. So just be aware that some of these things we've spoken about will depend basically on the state that you're in and the opportunities available. So as we close this all out and we really look at a fiduciary process, Chelsea started talking about it, right? It's about policies and procedures, the documentation that you have, procurement process controls. How are you doing this? Are you relying on somebody who's charging $50,000 to put two vendors to put out an RFP? And then how are you going to monitor and control? Brenda and Chelsea, what other final comments would you have here?
This sounds really complicated, this whole thing, right? And I think I've seen the attitude from HR CFOs that like, oh well, like, no, this is just too much. I'm gonna go to a PEO, right? Like, professional employment organization, thinking like, well, if I put all my business with a PEO, then I don't have the liability. That's not true. That's not like the ERISA fiduciary liability still lies with you for making that decision. Or let's say, I'm going to bundle all of my insurances with one brokerage just for the ease of it. Those types of decisions, there's no easy way around being a fiduciary. Like, there just isn't. So the biggest kind of like, it sounds harder than it is, but it's also not easy. But it's really just picking the right people who have your best interest in mind. And the only way to know that is to follow the money. How and when are they being paid? I think that would be like, if you're sitting here and you're overwhelmed, like the very first thing I would look at. Follow the money, you will find your answers, right? And then secondly, there are systems out there, like we provide this to our clients. It's a fiduciary portal, and it's a streamlined step-by-step process where it's documenting absolutely everything from procurement, the disclosures, the insurances, conflicts of interest that might exist either on the committee or with the vendors you're selecting. How is the plan performing? How does it benchmark? How does the compensation of the broker benchmark? All of that can be done within a platform if this feels overwhelming for you, or you can do it yourself with your consultant.
And, again, a platform sounds amazing, but it also, documentation is where it's at.
Yeah.
Documenting your process. I was just on a request for a proposal earlier today, an RFP group, and amazing group, but then it was who is the decision maker, and it varied. And so I was speaking with the lead group, and I said this might be an area where we really want to check and make sure that they have a benefits committee that will be looking at this and determining if that's the correct decision maker to be determining who these people, who's going to potentially be providing the service. So, Brenda, I know you have some final thoughts. Why don't you do that, and then I'll close us out. And then please feel free to start dropping questions or comments in the chat.
Sure. So basically, I just wanted to say to all the CFOs out there, as CFOs, our fiduciary duty extends beyond the financial statements. It reaches into the well-being of our employees through the stewardships of our benefit plans. And we have to ensure that the plans are managed with the same rigor and oversight as corporate finances. We have to regularly review plan performance, fees, and compliance with ERISA and other applicable regulations. We need to partner with trusted advisors and stay transparent with plan participants and make decisions solely in the best interests of employees and beneficiaries. Remember that missteps here don't just carry legal risks, they impact real lives and trust. Treat this responsibility with the gravity it deserves. Your employees deserve it as well.
And I'm just going to close out. Employers are the second largest group of payers in the American market. Medicare, CMS, the federal government is the first. So we also know that healthcare isn't working for anyone. It's not working for you as a purchaser, and it's certainly probably not working for your employees. Even if you're paying $25,000, $30,000, $40,000 per year for their care. You as an employer have tremendous power. We have a saying in public health, and it's called collective action. It's that one person carrying a sign or demanding a change may not get very far. But as you collect more and more people standing up and saying, we're not going to allow gag clauses, we demand our data, those voices together start to be to the point where no one can ignore them. So what we need to be working together is to creating a unified voice, demanding more from the market, our legislators, and our healthcare system, because the choices that you make with your plan with your employees ultimately can create and drive radical change. I'm not seeing any questions. I'm sure that we've given plenty to talk about, but you will know how to get a hold of us. And certainly, we will send out an email with the slides and all of our contact information. So please, please, please feel free to get a hold of us and tap into our knowledge and experience. We thank you so much for spending this time together. Oh, here's a question.
Thank you.
Thank you. Okay, well, thank you. I think that was super valuable. So we'll let you go a few minutes early and hope that you have a wonderful rest of the day.
Thanks, everyone.
You. Bye.